everyone's talking about how COVID is changing the world and accelerating some trends, and this is definitely one of them. You know, they think about telehealth as being just the ability to talk to your doctor remotely, but it's also about being able having at your fingertips the ability to take care of yourself and have more personalized information. Right? That's what tracking your own symptoms, your own condition, and the environment around you is what's enabling this. So, but how do we encourage that self-care? You know, how do digital therapeutics use the data to help people manage and improve their conditions better? You know, practically, how do they do that?
Right. Well. So I think one of the keys here is that digital health solutions can offer kind of a feedback loop, right? And so what's unique about DailyBreath is we want to track your symptoms, your earliest onset symptoms, the warning signals that are associated potentially with your exposures outside, right? And once we start tracking those, then we're developing kind of a profile for what is your individual susceptibility to specific conditions that you may experience. So next time we can forecast, if you're going to go out, what you might experience, right? And so I think that it's that feedback loop that becomes really, really powerful, because people want to receive personalized insights. The way we've treated exposures to date has been based on what I call kind of a distributed public health broadcast model, right? You see an air quality index for a particular zip code, and what that's defining is that everybody within that zip code is impacted by that air quality exposures the same way. And what we're trying to do is flip that and say, listen, we each experience the exposures differently, right? Our exposure footprint is just like our genetic footprint, very, very unique. And so can we begin to capture that information and then use that information for the patient? I envision them actually using that information to, you know, reduce and avoid their triggers, but also we actually can begin to develop information about what's the drug interaction with those particular exposures. You know, are particular allergy medicines or particular asthma medications more effective or less effective, or can they be more targeted with precision medicine in the future? All of these things I think are possible when you have an information loop that defines symptoms and, you know, the exposures.
Yeah. So it's not just about personalized environmental data. What is the exact level of pollution or pollen or specific pollutant that you're being exposed to, but it's how your body, how you react to each one of those pollutants. So there might be a high level of, I don't know, oak pollen or carbon monoxide, and you might be an asthmatic that's reacted in one way, and I might be reacting to it in another. And it's about understanding that relationship between each individual and the exact pollution, environmental factors that they're touching on. It's also interesting. Sorry. Go ahead.
Yeah, well, and exactly. And I think the one thing that's been the gap is the way we've approached pollen previously is to focus on trees, weeds, and grasses, okay? And that's usually by seasonal observations. When do I experience allergies? Oh, trees in the spring, grasses in the summer, weeds in the fall. And yet, you know, we're actually vulnerable to specific types of trees. So as you indicated, some people might be vulnerable to oak trees. Well, we don't even have that, you know, predominant pollen type, you know, in most of the applications that are out there. And so, you know, if you want to really deliver kind of personalized information, we need to know exactly what they're being impacted. The second thing is that you identified, we don't even know what the interaction between CO2 is in pollen. You know, what is the impact of carbon dioxide on intensity of pollen, or the allergenicity, which is kind of, you know, the impact it has on that individual, right? It could be definitely impacting you differently on any given day based on some weather changes or some weather impacts and those kinds of things.
Yeah, I think that interaction, the more local we can get information, we can also better understand the interaction between the different elements of the environment. With climate change, there's a lot happening in that sense. Pollen seasons getting longer, etc.